So for saline implants, we don't have imaging recommendations. So the reason we image silicone implants is because they have what's called a silent rupture. You won't know if the silicone implant ruptures right away. So it can lead to problems like contracture down the road, but you often don't know immediately. Whereas when a saline implant ruptures, you typically know right away because the implant goes flat. Now, that being said, it's still very important to be examined when you have saline implants because I find in my geographic area, the contracture rates for old saline implants are actually really high because back when the silicone implants were off the market, everybody was having saline implants placed. And during that time period, many of them were placed through areola incisions or axillary incisions, which have a much higher risk of contracture. Now, the changes that come with capsular contracture or lots of problems that we see in the breast, they happen slowly over this series of months or years. And as a patient, you may not even notice it. And this is one of the reasons why it's important to go for follow-up even if you're feeling fine, because an expert clinician can diagnose things that you may not notice as a patient because it's happening slowly. And also, this is why it's important that the clinicians examine you properly and document it properly. So they write in your chart what your implant feels like. So next year, if it feels differently, we can intervene. A contracture surgery with a more mild contracture is a much easier, much less expensive problem for you as a patient than something more severe. So no, there's no imaging requirements if you have saline implants like there is with silicone implants, but of course always important to have an expert examine you and follow your progress to make sure complications aren't developing.